This is Walk with a Doc, January 2018. So I have the pleasure of introducing Dr. Larry Bish.
So I see some familiar faces. Thanks for coming out. So today I've been asked to give a brief introduction about some of the lesser known types of cardiac imaging. So as you know, when you come to the doctor's office, including the cardiologist, part of the tests that are ordered often involve imaging or getting more information visually about the organ of interest. For example, if you break a leg, that would involve a chest x-ray. For those of you who see one of us or see a cardiologist somewhere, the more common forms of cardiac imaging involve echo or ultrasound of the heart. Has anyone here ever had an echo? Okay, yeah. Or nuclear cardiology, or a nuclear stress test, the test that takes about a half a day. Has anyone?
I'm scheduled.
Scheduled, yes. So those are all the tests that most people have heard about when it comes to taking a look at the heart. There are two other forms of imaging that we also use that not many people have heard about, and that's why today I wanted to give you a brief introduction and then answer any questions that you guys might have about that. The first thing I thought would be interesting, almost everybody raised their hand and said they had an MRI before. Has anyone ever had an MRI of their heart before? No. That's what I thought. So I'm going to start off by talking about cardiac MRI and why we may use it, who would be eligible, what kind of information we get. It's a relatively newer technology, and when I say newer, as you know, medical technology takes years and years often before it becomes popular and takes off. So this has been around for a decade or longer, but it's just now becoming popular and becoming more widely accepted. And it is actually offered at Doylestown Hospital as well. So in terms of MRI, so those of you that like to do reading about the tests you're getting probably know that MRI stands for magnetic resonance imaging. Very complicated terminology there. But the bottom line is, what's going on is we're using a very strong magnetic field to create an image of the organ of interest. Many of you have probably had it of maybe bones, the spine, brain, or so forth. But the same idea applies to the heart. We're just using a very strong magnet, strong electric field, or strong magnetic field, sorry, to create images of the heart. As those of you who had an MRI know that the magnetic field itself is very noisy, so those earplugs definitely come in handy. As I mentioned, it's all based on magnetism, so this study, unlike a CAT scan or like a nuclear stress test, doesn't involve any radiation at all. So from a radiation standpoint, the exposure is zero. There's no radiation here. So that's a big advantage of MRI in general and cardiac MRI is that it's a test that can give us some information that we're going to talk about shortly without any radiation exposure. However, what you have to watch out for is it is a magnet. So the consideration that comes up is, do you have any metal in your body? The most common contraindication, a reason why you couldn't get it, actually applies to a lot of our veterans who may have been in one of the wars and may have retained bullets or retained shrapnel. Any kind of metal that would become activated in the magnetic field could actually cause injury to you during an MRI. So before you get an MRI of any organ, including an MRI of the heart, they'll ask you about any metal in the body. The good news is, for people with orthopedic implants or hip replacements, joint replacements, most of the new metals that they're using for those replacements are MRI compatible. And of course, before you ever to get one of these studies, the MRI technician as well as the doctor performing the study would talk to you and double check with the manufacturer of that joint replacement to figure out if it is MRI compatible. But the good news is all the almost universally the new hardware is compatible with the MRI. Other questions sometimes people ask are about, what if I have cardiac stents? Is that, there we go, good. So perfect timing. Cardiac stents are also compatible with the MRI machine as well. So that's good.
And the catheter?
What's that?
And the heart monitor, regulator?
What kind of monitor do you have?
Well, I don't have it.
Oh.
Is that also okay?
Oh, sorry, what kind of monitor?
I don't have.
Oh, a pacemaker?
Yeah.
Yep, so that was going to be, that's probably on the next point right here. So if you have a pacemaker or defibrillator, that's going to be something you want to ask your doctor about. We have to make sure the magnetic field can disrupt the function of the pacemaker and the defibrillator. So in many patients, it can be done safely, but it's patient specific. So if it comes to a discussion of whether or not you're going to get an MRI for any part of the body, including the heart, there'll be a discussion as to whether or not you would be safe to have the MRI done with a pacemaker or defibrillator. And as I mentioned, in many cases, it is safe, and it's done with the cardiologist reviewing your record and approving it, as well as with the, a technician from the pacemaker or defibrillator company present during the study. So the answer is it can be done in most cases, but we do have to check before. Other considerations are, for those of you who have had it may know that claustrophobia could be an issue here. So you just want to make sure that you're okay in enclosed spaces. Some of the newer machines are more open, but it does involve, in many cases, going into a more narrow tunnel and, again, wearing the earplugs because the magnetic field is very noisy. And some patients with reduced kidney function may be limited in the type of study they can get. In terms of the information that we can get, the take-home message here is that cardiac MRI is a very comprehensive study. And as it continues to catch on, it may start to replace other types of cardiac imaging. So in one cardiac MRI study that takes about 30 to 45 minutes, we can get all this information. We can get information about your heart function or ejection fraction, for those of you who have heard that term. We can get information about valve problems with the heart. We can actually perform a stress test while you're in the MRI machine as well. You can't, not the type where you exercise, but the type where you get the medical injection. We can look for tumors or blood clots in the heart. We can also track the size of your aorta. And it's especially useful for patients that have aortic aneurysm or enlarged aorta, because say if you were requiring multiple studies over time, for example, an annual CT scan, which is done in the past to look at the size of the aorta, that's exposing you to radiation each year. This would not expose you to radiation if this were used to track the size of the aorta over time. So again, one study done in 30 to 45 minutes could give us all this information. So it's a very, very comprehensive test. I apologize, I don't have active videos that are working, but this is the type of picture we get of the heart in the MRI machine. This is the outline of the heart here, and we actually create videos of the heart itself during the analysis process. And again, I apologize that I don't have the live videos available today, but we can create live videos of the heart beating with cardiac MRI. So a very useful and comprehensive technology that actually does not involve any radiation exposure. So I'd say keep your ears and eyes tuned, because going forward, it may be recommended that you get one of these, a cardiac MRI done in the future to help assess your heart function and the plan going forward to treat your heart disease. Any questions about MRI before I do the intro on CT? Okay. So cardiac CT, so the CT, also known as a CAT scan in common terminology. How many of you guys have had a CAT scan before? Okay. And has anyone had a CAT scan of the heart? Okay, again, that's kind of what I expected as well. Again, CAT scans or CT scans have been around for a long time, and now we're learning how to apply this technology to gain much more information about the heart as well, in addition to other organs that are commonly imaged, such as the lungs, the stomach, or the brain. Compared to MRI, CAT scans do involve the use of radiation, so that's a consideration. It's not a test we want to do multiple times, because that could put you at risk for increased radiation exposure. And also is performed with and without contrast dye. So some of you that had your CAT scan may have had an injection that gave you that warm feeling and then helped us get additional information about the organ of interest. Considerations about the contrast can include patients that have allergies to the contrast. That allergic reaction is somewhat common. And also, it can affect your kidney function as well, so we do have to screen for kidney function if you're going to be getting the type of CAT scan that involves the contrast. So cardiac CT has many different applications. the kind of main difference here between the MRI and the CT is before going into the CT, you need to pick which one you're looking for. A lot of times we can't do all these at the same time because it has to do with the timing of when we're taking the pictures. Whereas that MRI can actually, all the indications that we discussed before can be done, a comprehensive study can be done all at one time. For the CAT scan, we're going to kind of pick and choose what we want to look for. And CAT scan is very versatile in terms of what we want to look at. The top one is something that's actually very new coming out, and you may or may not have heard about this. It's called a coronary calcium score. And what that does, this is actually a study that's very low radiation and very quick and does not involve contrast. And it's starting to become more popular because of that, because it's quick, low risk for and low risk for radiation. What it does is takes a quick look at the arteries of your heart and tells us, is there calcium or not? And the reason we care is that can help us calculate, or at least get a good idea of what risk you have for having a heart attack in the future, and if you should be on a cholesterol-lowering medication. So this technology is being used sometimes when we're on the fence about whether or not someone should start a medication like a statin, like Lipitor or Crestor. If we can get a calcium score and it's high, then we would say you're someone that should be on this medication. And if it were low or zero, we could say you don't need this medication. So just keep your ears out for the calcium score, because this is becoming more popular these days. Oh yes, go ahead please. So moderate range is 100 to 400. So greater than 400 would be considered a high score. Under 100 is low. And 0 to 10 would be almost non-existent. Yeah, no problem. Any other questions about the calcium score? Oh yeah, go ahead.
Does this come off your blood analysis, that number you just gave?
The number is separate from the blood analysis, so that's usually the cholesterol analysis that's done through your blood.
Yes.
The calcium score, this number that's ranging to 0 to 400 plus, is being calculated based on how much calcium we detect from the images. So it's all imaging based. So, and again, this doesn't involve contrast, so this procedure is done without any needles and takes only about 10 minutes or so. Yeah. Any other questions about that? Okay. Other applications of cardiac CT can be something called CT angiography, or it's a CT scan where we look at the blood vessels of the heart. And this can be helpful in some people presenting with chest pain to get an idea of, are there any narrowings or blockages in the heart. This is best for people that are low risk, that haven't had heart attacks before, and don't have too many risk factors. And the reason it's useful is because it may help to save those people from having to undergo a more comprehensive stress test or even a heart catheterization in a low-risk patient who's having chest pain, if we can take a look with a CT scan and see that the arteries look relatively normal. So that's CT angiography. Quickly, these other ones down here, CT pulmonary embolism looks for blood clots in the lungs. You may have heard, you see commercials on TV now for DVT and PE. That's the PE component, the lung clot, is diagnosed by a CAT scan. And then we can also, just like we talked about for the MRI, we can also look at the size of the aorta or track aortic aneurysms with the CAT scan of the heart as well. And finally, we can assess for fluid around the heart too. So to give you an idea of what these images look like, quality is not the best. This is the outline of the heart here. Let's see. Fortunately, the images are a little washed out here. Let's see. This one's a little better. This is a nice show and tell one. This is one where we were looking for a blood clot in the arteries going to the lungs. So the blood clot would have originated in the right side of the heart and then started traveling to the lungs. The normal part here is all the white part. This black part here is a big blood clot. So in this case, this study was helpful in diagnosing a new blood clot to get this patient on blood thinners. So again, before we start the exercise component of the program, I wanted to introduce you guys to two relatively new methods of imaging the heart, cardiac MRI and cardiac CT, who might be eligible for it, why we might use it, and what information we can get from it. I hope this was useful, and I don't know if anyone has any questions about either of the imaging modalities. Yes?
Just because I used to work for an insurance company.
Yes.
Is this MRI covered
In most cases, the MRI is covered. The study right now that's not being covered is that calcium score we talked about from the CT scan. And there's usually, it's not really a copay because it's not covered. Depending on where you get it, it's usually in the neighborhood of $150 to $200 for the, that calcium score by CT scan. The MRI, we usually, someone from our office would work with your insurance company to get it covered. Yeah. Mm-hmm. Any other questions? Oh yeah, go ahead, sir.
What would be the cause of this calcium buildup that you have? Is that from what you eat, lack
Yeah.
of exercise?
That's great. You're naming excuse me here. You're actually naming all the causes here. So it's what we call multifactorial. It has to do with a lot of things. And some people, it's genetics. So people who have family members that have had heart attacks at younger ages, such as in their 40s or 50s, are more prone to have calcium building up in their arteries at a younger age. So that would be a genetic component. But also patients that lead a sedentary lifestyle, basically patients that aren't exercising, patients that have a diet high in fat, and patients that have uncontrolled diabetes or uncontrolled high blood pressure. Those patient populations would all be at higher risk for having calcium buildup in their compared to patients who exercise regularly, don't have a family history, or who have diabetes or high blood pressure, but control it very well with their diet and with exercise and medication. Yeah. Oh, go ahead.
Are calciums the same as plaques?
It's similar. The calcium buildup is part of the process of the development of what we call the technical term atherosclerotic plaque in the coronary arteries. To get technical, not all plaques have calcium, but most of them do. And what we're doing is we're using the calcium as a marker to say that that person is likely at risk for developing more severe atherosclerosis and atherosclerotic plaques. Although, to be fair, there are some cases where the plaques don't have calcium, but in most cases they do. Okay, thank you everyone. Thanks for the questions.